So my name is Greg Adams, as you've heard. Thank you for the introduction. I work for UpToDate. For those of you who don't know what UpToDate is, it is the leading clinical decision support system in the world. About 1 million doctors consult it every day. And if my presentation is not the most entertaining, we can blame it on jet lag. I arrived at 4 o'clock this morning, so hopefully that won't impede my performance too much. I'm very, very happy to be here, and I want to thank the Apollo Group for their hospitality. It's been a fantastic experience already. And so I want to talk about putting data in the service of the patient, and more importantly, how can data be used and leveraged to improve patient safety and improve outcomes. So in the context of clinical decision support, if I were to poll a room full of health informaticists and doctors about what is clinical decision support, I would probably get a lot of different answers. Many people have a different definition, and usually what comes to mind are alerts. You know, don't do that, don't prescribe this with that, there's an interaction. And yes, that is part of clinical decision support, but that is not all of clinical decision support, since decision support should not just tell you what not to do, but also what to do and how to do it. And that is really our philosophy at UpToDate. So where does all this come from? Well, the concept comes from a body of evidence, a lot of different studies that have been conducted about what happens when doctors see patients. Some of these studies are reflected on this slide here, and what they have shown is that when doctors see patients, they have questions. What is wrong with this patient? What do I need to do to make this patient better, and how? Pretty basic questions. Now, what these studies have also shown is that only 40% of the time does the doctor really know the answer to those questions, which means that 60% of the time they are guessing. And that's a scary thought. Now, the good news is it's usually a pretty good guess. It's usually a pretty good educated guess, but I don't know about you. If I'm the patient on the table, I don't want them to be guessing at all, of course. And so what these studies have further shown is that if we can provide these doctors with the best quality evidence-based answers to these questions, we can change between 5 to 8 patient management decisions per doctor per day. So if you think of your typical hospital, numbers of doctors there, numbers of days in the year, you can think of what the impact could potentially be, and that is quite large, of course. Another challenge is that the amount of clinical information has just grown exponentially over the last few years. In 1965, there were just 39 randomized trials that were published in medicine. By 2011, there were over 21,000. By the end of 2015, there will probably be 35,000. It is just not possible to stay on top of all of the information in your own specialty as a doctor, let alone all of the parallel disciplines. There's just too much information for anyone to be able to digest and manage. So how do you manage that? Well, here is the concept of clinical decision support. You need to provide actionable recommendations that help with the right guidance at the right time to get to the right decision in a context and a format that is pertinent and useful for the doctors. What do I do for this patient right here, right now, and how do I do it? So, sorry about that. So this is very widely used, as I said. Over 1 million doctors consult it every day. And so because this is the most widely used clinical decision support system in the world, it's also the most studied. There have been more than 60 independent studies that have looked at the impact of clinical decision support on improving decisions, reducing complications, reducing mortality, and reducing costs. This is one of these studies. This one was conducted at Singapore National University Hospital. For those of you who are not familiar with that fine institution, it is one of the leading hospitals in Southeast Asia. And like all of the best hospitals in the world, they've been using this for quite a long time. And what they were asking is an interesting question. They said, we know our doctors use this a lot, but how often does it actually change their clinical decisions? And what they found after conducting a study is that 37% of the time, after consulting this system, the doctors changed their diagnosis decision or their treatment decision or both. And when the hospital management saw this, they were very shocked. They said, what do you mean 37% of the time? We're a great hospital. We thought we had good doctors. What's happening here? Well, of course, Doctors don't consult this for every single patient encounter. If a patient comes in with a twisted ankle or a simple ear infection, hopefully the doctor does not need an expert system to tell them what to do, of course. So when do they use something like this? When it is a very complicated disease, maybe a rare condition, maybe something where the treatment has been evolving very quickly over the last few years. Maybe it's outside of their specialty, advanced chronic disease, complicated comorbidities. In those cases, of course, it makes a lot of sense that they need an expert system. And in those cases, of course, it also makes a lot of sense that it has this kind of an impact. So about 1/3 of the time helps them improve diagnosis, treatment, or both. But what this also shows is that 2/3 of the time it confirms and reinforces their decision, and of course that's equally important for doctors. So this is another interesting study. This one was conducted by the Solution Group. I don't know if you're familiar with them. They're now part of Thomson Reuters. They maintain a database of 26 million discharges from 2,900 hospitals, and they wanted to compare the hospitals that use this clinical decision support system to those who do not, after eliminating all other variables such as the size of the hospital, whether it is public or private, teaching or non-teaching, and also comparing hospitals with themselves, how they performed before and after implementation. What they found is that this was associated with significantly lowering the adverse outcome rates, significantly lowering complication rates, and reducing the length of stay by 0.167 days per discharge, which of course means that every patient, 1 patient out of 6 gets to go home 1 day earlier, which is fantastic for the patient, but also helps save quite a bit of money. Now, after that study was published, Harvard Medical School, I'm sure most of you have heard of Harvard, published a follow-on study and to have a much more methodical approach as to what is the impact of this clinical decision support system on hospital quality and patient outcomes. And what they found is that not only did they confirm the findings of the previous study, but they also found that this helped improve hospital quality by impacting every factor on the Hospital Quality Alliance metrics. These are standardized factors such as infection rates, readmission rates, complication rates, etc. The next finding is that this had reduced the length of stay by 372,000 days per year, which of course has a massive impact on quality of life for the patients, but again, a large financial impact as well. But the third finding is really the most important of all, and that is that this was associated with saving 11,500 lives over 3 years, and that if all of the hospitals in the study had used it, an additional 16,650 lives could have been saved. Now, for those of you who are doctors or work in the medical sciences, you're probably well aware that it is very difficult to be able to prove even an association of any kind of treatment or therapy or drug with a mortality reduction. But yet, the researchers at Harvard feel very strongly that they're able to do that here. And by the way, we're very happy to share that study with you if you'd like to see it. So this is the last study. As I said, there were more than 60 of them. I just want to give you an overview. This one was on return on investment. So obviously, all of us here, I'm sure, agree that quality of care is important, patient safety is important, outcomes are important. But in many health environments, healthcare systems, controlling cost is equally important. And that's definitely the case also with the NHS in the UK. I don't know if you know the Royal NHS, Salford Royal NHS Foundation Trust in the north of England, but that was a challenge that they had as well. So they wanted to implement this more broadly, but they could not do so before understanding the return on investment. So they hired a company that's specialized in doing these sorts of evaluations and calculations. They're called Forrester Research. And what they found is that they could realize a return on investment in 90 days, meaning that for every pound that they put in, they got more than 4 pounds back in savings. And they were quite surprised by those results. They said, that seems a little bit high. Where does that come from? Well, it came from mainly 2 areas. The first one is an improvement in the clinical staff productivity. If doctors can make better diagnosis decisions and better treatment decisions because they have better information, obviously that means that patients get better faster with fewer visits, less complications, less errors, less medicine. That saves money. But the second factor had an even bigger financial impact. And that is the more efficient use of diagnostic testing, because when doctors are not sure what is wrong with the patient, one of the first reflexes is to order more diagnostic tests. and these tests are quite expensive. So if we can answer all of their clinical questions with high-quality, evidence-based answers, many of these tests are no longer necessary. And if we eliminate just a small part of those unnecessary tests, it leads to huge financial savings. And the third finding, but of course we already knew that, is that it also improves the quality of care. So because of this, this is very, very widely used. More than 30,000 hospitals use this in 174 countries. And actually some countries have decided to deploy this and buy this nationally for their entire healthcare system. It's the case of Norway, Spain, Saudi Arabia, Jordan, Oman, Iran. And in other countries, they haven't decided to buy it nationally, but every hospital, every healthcare institution has bought it individually, so they have, in effect, the equivalent of a national license as well. That's the case in the United States, the Netherlands, Switzerland, Luxembourg, and a couple of others. So you may remember just a few minutes ago, I talked about the concept of clinical decision support is really to have it embedded, integrated in the workflow. So to be able to know when you have the patient right in front of you, what do I do for this patient right here, right now, and how do I do that? And so let's talk for a minute about embedding and integration. So we've asked doctors all over the world, in their view, which health IT initiative in their own hospital do they feel has the biggest impact on the quality of care and patient safety. And you can see that by far, the number one response is a leading clinical decision support system. The next system, in doctor's view, is an electronic medical record system. And you can see that e-prescriptions is next. So we've also asked, we ask a lot of questions to our millions of users around the world. Another question we've asked them is, what do you feel is the result, what is the impact of embedding this clinical decision support system in your electronic health record, in your EMR, in your health IT infrastructure? So in 2011, 91% of them felt that it improved patient care. 89% of them felt that it improved their satisfaction with the EHR system, and 40% said that it also increased their usage of that system. And then in 2015, we actually asked that same question again, and you can see that not only do they still feel very strongly about that, but their sentiment has increased. So they feel that now more than ever, this is really important to patient safety, to improving their satisfaction with their electronic health records and health IT systems, and increases their use of them. So to conclude, based on our experience in more than 30,000 hospitals around the world, we're convinced that if you truly embed, truly integrate clinical decision support systems into your health IT infrastructure, into your electronic health records, it'll help improve the quality of care. It'll improve medical knowledge for your clinical staff and your clinical teams. It'll help reduce complications, reduce errors, which will surely help you save more lives, but also most probably help you save a lot of money. Thank you.